Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health Podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.
Hey, welcome back to the Wild Health Podcast. This is Ben Askins hosting today, physician assistant in psychiatry. And I've got Thad Frye back on the podcast here. We had a previous podcast with Thad where Dr. Tom McCoy and I had interviewed him about some of his approach to mental health with athletes. However, about halfway through the podcast, I had some technical difficulties and dropped out. And anytime that I wind up getting cut from a podcast recording, it tends to just increase the quality of the content nonetheless. However, Thad was gracious enough to be willing to come back and spend some extra time here with me and just answer a few extra lingering questions that I had hanging out there. So welcome back to the podcast, Thad.
Thank you so much, Ben. Appreciate it. And I don't know that it got any better, but it's nice to be with you today.
I appreciate that. Time will tell, and the audience will be the ultimate judge as usual,
Yes,
right?
Yes.
But the previous podcast, if you hadn't listened to it, I would recommend you go back and give that a listen, where we do a bit of a rundown through some of your practice as a licensed clinical social worker and an expert on brain spotting, especially with respect to athletes. We talked some about the yips, and none of us caught them, as contagious as they might be when we talked about it. You were able to explain a bit about how to get from being yippy to being yippee-ki-yay. If you want to give us a little rundown on how all of that works, just as a refresher before we dive into some fresh material, that'd be great.
Yeah, that'd be awesome. Thank you for bringing that back up. Love working with athletes, performers, and so this gives me an opportunity to kind of touch base back on that. So again, brain spotting is a somatic modality, helps us be able to access our limbic brain, that midbrain. So not when you think about traditional therapy and kind of that talk therapy, there is some talking, but again, we allow ourselves to go into that limbic mid part of the brain, that fight, flight, or freeze response, memories, emotions, and are able to access that, process any held trauma, process that through, get to a place where we feel more calm and balanced in our bodies and not stay in that fight, flight, or freeze response that we might previously. So like you spoke to with the yips, and as we were joking about before, that idea that they are contagious, it's nice to have athletes that do have the yips, and then by being able to be with these fixed eye positions, being with what comes up in their bodies, they're actually able to process through it. And it's usually not about the yips themselves, about the action that's happening. Yes, that's embarrassing. Yes, that's taking them out of the sport they love, but it's usually some earlier life experience, maybe sports related, sometimes not, that we end up processing through, that allows them to re-access what they already know how to do, what they've been practicing for a long time. So that's kind of a quick update on the yips.
Right on. Thank you for that. As I was listening to you describe brain spotting previously, and even now as you're giving us the rundown here, what it made me think of was what's been called the tactical athletes. In my youth, I was something of a tactical athlete myself as a combat medic for over a decade. And we have a lot of patients and clients who are veterans, law enforcement, first responders, firefighters, EMTs, doctors, nurses, folks that are, placed in extreme situations. So as a vet, I typically was looking for multi-tools anytime that I got the opportunity. Like famous K-Bar knife company makes a spork, the K-Spork.
Yes,
and that
of course.
I had
of
a
course,
K-Spork,
yes.
and I traveled the world with that thing. And if you're living out of a rucksack, everything that you're going to stuff in there, it's got to have at least 3 uses, or you don't want to carry it. You don't want to deal with it. It's not worth the weight. And when you were describing Brainspotting, it seemed to me like this perfect multi-tool where it has the potential, if tactical athletes acquired some familiarity with it, to both help with performance, where high performance is a requirement of being a soldier or a law enforcement officer or a first responder of whatever kind. On the front end, it'll help someone do their job better. And then on the back end, in the way that it can help with processing emotion and healing from the accumulation of traumas that people experience in those contexts, it would help people to come home more fully afterwards. And I was just wondering if you could explain or elaborate or give us some of your experiences around those 2 sides of the coin that seem like you would have to come at them from very separate ways, but it seems like Brainspotting might be able to integrate.
I love that, and I work with a lot of first responders and veterans, and I've noticed that a lot of folks, we've had people that were former first responders or veterans in a lot of our trainings and Brainspotting trainings, and when I assist, they tend to ask the best questions around that type of stuff because they are often looking for being able to utilize it for multiple uses, just as you spoke to. So what a great question. So the way that I look at it is that since we're looking at, again, that limbic part of our brain, that subconscious part of our brain, if we can allow ourselves to go in there and face whatever might be there. Sometimes it's known issues that we're working on, and sometimes, again, it can be things from far back. Often people that are willing to jump in there and do that work, then it allows us to free up space. And like we talked about last time, we don't get into these ways of thinking. We don't get in ways of muscle guarding. We literally can feel differently in our body. So when you were talking about that part of you to be able to do the job, to be able to go follow through, to be able to be in the moment and do what you've trained all this time to do, it allows us to free ourselves up to be more in that cognitive brain, to be able to do what our bodies already enable us to do. And then when the time is right, with a therapist, then when they're coming back, and I've worked with people that have been actually overseas before they've actually come back home to kind of do some prep work, then it allows them to free up whatever they went through so that transition becomes easier. It's not I'm there, now I'm here, I don't know how to be in either place, right? So we're helping them work back into a place where they feel more like themselves. And so it allows, like you said, access to both the front end and the back end, because we're working with that part of our brain that influences us all the time, and we don't realize that it's influencing us all the time.
Yeah, it seems kind of like a cheat code to flow states. Like I can be in a high performance state if I'm able to access this, and then I could also be in a flow state of calm and relaxation in either the chaos of a military operation or the chaos of just family life in a house full of children or roommates or what have you.
There you go. And especially once myself or somebody is working with them and working them through some of whatever they've been going through, again, historically or more recently, then you can teach people to do, like we talked about, self brain spotting. So then people can allow themselves, as I tell people, if you can do it for 10, 15 minutes and allow yourself just to, as you would do with your therapist or your coach or whomever, and allow yourself to feel the best you felt, even amongst the chaos, as you were saying, that you felt like, I'm on this, I know what I'm doing, I can feel it in my body. Where are you feeling it in your body, right? Walking yourself through that. Okay, I'm feeling it in my chest. How much am I feeling at 0 to 10? Allowing myself to drop into the literal feeling of it so that we can enact that, so we can bring that forward in ourselves. So in some ways I can see it being a cheat code. So I like that verbiage.
Yeah, it seems in your description of it to be a kind of a non-ordinary state of consciousness, which is a
Absolutely.
sort of a buzzword that we
Yeah.
use in research papers talking
Yep.
about psychedelic assisted psychotherapy of a variety of sorts. And you'd said on on the previous podcast that you've got some training in trying to
Yeah.
bring together the brain spotting world and the ketamine assisted psychotherapy world. And I
Yeah.
wanted to hear a bit more about that. Particularly, you had shared an anecdote about a patient that had felt sort of trapped in a cocoon in this non-ordinary ketamine experience, and then in coming out of the cocoon of the experience, sort of becoming the beautiful butterfly or
Yes.
moth
Yes.
or whatever it is that comes outside of
But
that
butterfly.
particular
Butterfly. Yes.
cocoon might have been.
Sure.
Um,
Sure.
but I wanted to hear a bit more about how you think brain spotting dovetails up with both, you had mentioned intention setting before
Yeah.
these experiences and integration after another experience of non-ordinary state of consciousness.
Yes, very much so. So let's start with intention setting. So intention setting, I love that part, even though I do a lot more integration work than I end up doing intention setting, because I think sometimes people believe intention setting is easier, right? We're just kind of bringing in, I want to understand myself. I want to understand self-love
Feels more
more.
like a do-it-yourself sort of thing.
Yeah,
Yeah.
yeah, and it often can be. I don't want to make it bigger than it needs to be. But what I like about doing that with brain spotting is, instead of, again, being with that more do-it-yourself cognitive, I'm just going to go with this. This sounds right. This is what I've read other people are doing, or it works for me. Again, not wanting to take away, nothing wrong with cognitive interventions around deciding what you want to land on, but then I help them find a more resourced spot related to that. So if it is around self-love, then sometimes by doing brain spotting, going to that non-ordinary state. So when you think about having questions about the way that you connect yourself around love, do you have self-love? Where are you feeling that? Again, finding a correlating eye position to work with that, to be able to go into, again, it's not a trance, but a more meditative state, to allow ourselves to access that mid part non-ordinary state. Sometimes people come out of those, and usually I won't do a full session, but they'll come out of that and they land in the same exact spot, which is great. Okay, that's what you want to hold. Other times there's memories around why they might be struggling with self-love. There might be those phrases that we all have, that I'm no good, right? That they're getting closer to what is telling them that was their intention. So we're kind of helping them, we're getting them past the starting line in this, because they're kissing cousins in some ways, having that non-ordinary state between any of our somatic based modalities, brain spotting, right, and then working with psychedelics. So I like that it usually helps us fine tune it. And so I'm not influencing. I'm not saying, I'm not cognitively, right, talking them through it and saying, I don't know, when you told me about XYZ, why don't we go over here? I'm letting them listen to themselves and seeing what bubbles up, that bottom up processing. So that's why I like doing intention setting if I have that opportunity.
Yeah, cognitive therapies I often think of as top down, and we're
Yes.
dealing with thoughts and verbal ways of orienting ourselves to our internal experience of the world. And then there's bottom up, more somatic, embodied therapies like somatic experiencing or
Yes.
emotions focused therapies that have more to do with, the body keeps the score being the famous book for trying to bring the two together. And then non-ordinary states of consciousness seem like this sort of sideways way of coming at things that isn't as much top down or even so much bottom up, but comes at it from a completely indescribable angle to some extent. And it seemed like Brainspotting comes at things from another side. It's sort of like bringing together one kind of non-ordinary state of consciousness into preparation for a completely different kind of non-ordinary state of consciousness, and then seeing what comes out, the top and the bottom, winds up being the way that integration could happen. Has that been anything like your experience?
I appreciate all of that. I mean, that as you said, that ineffable, right? I don't have the language for it. So that we talk a lot about that in psychedelics. It also comes out a lot in Brainspotting. I just had a couple sessions this morning, and somebody, right after we got done processing, or they got done processing, we often use bilateral sounds. They had their headphones on, and I try to give them a little bit of time to kind of come back into the room, as they say, and kind of get their feet on the floor and start talking. But I'll, usually say, what did you notice? What came up for you? And sometimes people take a while. They're like, I need a little time. I'm not sure how to explain it. And so there can be almost an integration work of allowing somebody to come back into a normal state of being, and then start to understand what did come up, because it can come up through images and memories. It can come up almost through daydreams. It can come up through riding the ups and downs of what you're feeling in your body. We often talk about a roller coaster, and with some people, those things are all happening at once. So it definitely can take some time. So I like that idea of it kind of coming in sideways, and then we're working with it to see what bubbles up, where they can think it through. How can they make it shift their behavior? How can they find a mantra that is quick enough to allow them to remember, oh yeah, I don't want to go my well-worn path, the way that I'm used to doing. I want to start looking at what these other roads tell me. And what am I noticing in my body? Maybe there's been many times where I've gone back and maybe, I haven't seen you for 2 weeks, and we worked on an issue related to anxiety in your stomach or an old surgery that happened to your knee. And I'll ask you about it. And it's great. Oftentimes people will say, oh yeah, thank you, I'm noticing it less, or it's about the same. But I've had many times where people go, oh my God, I forgot we were even working on that. I haven't even noticed it. So it's not only the not noticing it, but whatever that anxiety in their stomach or that knee difficulty also influenced in their life often is shifted too. So like I said, I like that idea of it coming from the side.
Yeah, it seems like a very holotropic way of viewing people, and then integrating and healing in therapy with them. Holotropic being a word that's meant to convey the idea of moving toward wholeness. That was coined by Dr. Stan Grof, a famous LSD researcher from the 60s and 70s that has exerted a significant amount of influence on psychedelic assisted approaches to psychotherapy even today. And I had to shift gears here a little bit in the conversation, shared a quote from Dr. Grof with you earlier, in part because I know that you've done this sort of work with athletes and with veterans and first responders, but that you've also got a background in hospice and palliative care, so that you've worked in grief contexts. And I just wanted to hear some of your reflections on the quote. So I'm going to read the quote for our audience and then just let you share whatever it brings up for you. The quote is, that there is no fundamental difference between the preparation for death and the practice of dying on the one hand, and spiritual practice leading to enlightenment on the other. What are your thoughts on that, Thad?
Yeah, that's no small quote, is it? So when I think about that quote, and it's a fairly well-known quote because of it being very powerful. So I often think about not only my work in hospice. Obviously, people have the opportunity to be really facing their death. We could do a larger context talk where people are not in a place, both medically or psychologically, to do so. But if we're talking about people that are of full awareness that they are facing their death, then to have those deep talks have been amazing. And I could, again, touch base on that. But when people are willing to do psychedelics when they are known to be that they have cancer or whatnot, and they are on hospice. One thing I've heard both in my work with only a couple, but also in my reading, is it's that preparation for death and dying. So if people are willing to, again, look into the abyss and look into what that might be like, not only do some people have a resonance and have a deeper understanding of whatever their belief system is coming in and coming out of those experiences, but they get to allow themselves to live differently during the time that they're here with us. And so that's one of the biggest parts that I take from the quote, is that looking at death and dying, we are allowing somebody to actually do their work so that not only at the time of death are they more prepared, but they're more prepared as they're going into it. So that's the biggest thing that I take from that quote.
Yeah, I think that's some really brilliant insight there. We talk a lot on this podcast about longevity medicine and
Sure.
extending the health span and supporting our patients through, every stage of life and trying to make the most of that, living wildly along the way. And it's nice to take just a brief moment here on the podcast and think about caring for clients all the way through the lifespan, and what end of life care looks like and means for each one of us. I've heard this other quote that comes from retired Lieutenant Colonel Dave Grossman's famous book On Combat, that I've tucked away in my pocket and has meant quite a bit to me. And it's just that joy shared is joy multiplied, and grief shared is grief divided. And one of our core values here at Wild Health is together we heal, which to me entails that we want to multiply joy with our patients as often as possible. And then we want to divide grief with them as often as is necessary, so that once it's divided, we can carry it together and it's a bit lighter. I'd be curious to hear, as a brain spotting therapist and a psychedelic assisted psychotherapist, how might you construct an end of life care and treatment protocol that takes all of those factors in, if you were going to do the ideal way that you would take care of a patient at the end of life? What might that look like?
Yeah, I appreciate that quote. It's definitely one that I've heard many times, and because it is so powerful, right? So let's go to the end part of that, especially is that, so if we're talking about a person who is looking at the end of their life, the idea, in some ways is already very much present. So I worked for hospice care here in Boulder for a very long time, between Austin, Texas, and Boulder, Colorado. And in one of the ways that they look at it is it being a multidisciplinary team. So looking at doctors, nurses, chaplains, if wanted, social workers, grief counselors. So already beautifully made up is all of those different people and their skill sets being the ones to hold not only the patient, and I'll just use the word patient here, but holding the family and potentially the larger community, if done well, if we have time. That's why I always try to tell people, I know this might sound odd, but if we know that somebody has a diagnosis where they have 6 months or less to live, the sooner they can get on with the team with a hospice, the sooner there can be familiarity, the sooner that they are not only their physical needs, which like we were talking about, yep, we want our physical needs, pain and all the things that come with end of life, but also psychological and spiritual and social. And so already I think there's a lot to be said there around the team aspect and working in collaboration. But let's go back into the person themselves. I think, again, not that this is for everybody, but the idea that we now have plant medicines or medicines that enable people to take a journey into their lived experience, but also any fears, obviously, of death or leaving people. And we get to allow them access, hopefully in the not too distant future, that becomes a more normalized thing, that it is an opportunity, not a have to. I love the couple of people that I've walked through that experience, that they've had that experience, and I should say, have been able to do intention setting or integration work with them. It's some of the most powerful moments, and I've had many, many beautiful moments in hospice. So again, just to be able to come alongside to hopefully get in there earlier, the earlier the better for the care team, but also in working with people like me, working with the psychotherapist, or working with people that are well trained within the plant medicine world, I think it affords people more opportunity, again, to not have to live the last days or months in fear. And a lot of what we've been talking about underlying this is fear. And so if we can allow people to not have to have that be their main influence, that's kind of one of the biggest things that I hope to be able to help people with.
Yeah, that's a beautiful thing. I think it's a beautiful picture to paint of the future where the option to offer psilocybin assisted psychotherapy at end of life becomes a reality. And like I imagine a future where veterans returning from deployment get offered MDMA assisted psychotherapy on the
Sure.
way home from every tour overseas that they get. And, maybe I'm just a big dreamer, but we'll see what the future
We
might
will
hold
see.
in that regard.
Yes.
I know
Yes.
I really appreciate your perspective on all of that. Thank you for giving us that insight. You had mentioned also on the previous podcast that you were going to be doing a presentation at the end of April on brain
Yeah.
spotting and psychedelics. Is that accurate? Still the case?
Yeah. I
Can I
appreciate
come?
you
How does
asking.
that work? Where is it? When is it? What's the
Yeah,
story there?
so I'm on the board of the Rocky Mountain Brainspotting Institute. We're a nonprofit out here in Boulder, but we serve the larger community as well. And we do what we call brown bags, which are on Fridays during lunch, hence the name. So we do an hour-long presentation and a half hour of Q&A. And we do this to raise money for, because our main focus is to do education around brain spotting, but it's also to be able to raise money so that people that can't afford brain spotting therapy, we can hook them up with a brain spotting therapist and pay that brain spotting therapist. So one of the ways that we raise money is bringing in people that are going to do larger presentations in the brain spotting world, or are just wanting to say, I haven't heard about how this connection in brain spotting has worked in the past. And so I kind of wanted to bring it to light. So I'm somewhere in the middle. I'm looking at coming up with a larger 1 to 2 day presentation on psychedelics and brain spotting. But for right now, I'll be doing that. Like you said, I believe it'll be on the 28th of April. And it'll be, again, just doing some basic. I want to be able to talk to the larger audience, because plenty of the brain spotting therapists and other therapists who might join us might not know too much about psychedelics. They might know that it was banned and that Nixon said we're not supposed to do anything about that, and Timothy Leary is the most dangerous man in the United States, and it might kind of look from that. And again, that's part of the story. But I'm going to talk about the history of psychedelics way back when, touch on it more recently, what the studies were that were happening when all of a sudden it stopped, all the way into what's been happening here with MAPS and some other people to be able to do funding for research that is happening now, Colorado, Oregon, Australia, all the different places that are starting to bring it into awareness. And then go from a brain spotting lens and touch on some of the topics that we've touched on: intention setting, integration work, maybe not being a psychedelic assisted therapist. But one of the biggest things that I want to tell people is that we are honored to have people come in and tell us their deepest, darkest things. And I've worked with a couple of people on integration work when the client has come in and they've said, I tried to share this with my therapist and I felt as though they were almost shaming me for having had this experience 20 years ago or last weekend. And it was very powerful, or it was difficult. And I wanted somebody to help me start to make sense of it and work through it and bring it back into my life. And so I just want to have people have an opportunity to see whether they want to be able to do it, or at least get enough information so that they don't shame people through their experience.
Wow, that's going to be a great presentation.
I hope so.
I feel like we got the Cliff's Notes right there.
You did.
Feel like we cheated.
You did.
The cheat code, slid that in there.
Yes.
All right,
Thank
you for that.
Yeah.
Well, I like to round things out at the end here with just one last question. If you could identify the wildly healthiest thing that you've ever witnessed or experienced in your journey through life, what would you say that thing is, Thad?
My gosh. I'm going to cheat a little bit and say a couple things. So, very much with what we're talking about right here. So I'll bring it about myself for a moment and then talk about some other folks. Very quickly, I stumbled into Brainspotting. A good friend of mine, as I shared last time, kind of introduced it to me through her own what she was the difficulties she was going on in her life. And I didn't know much about it. I didn't do research ahead of time on purpose. I just wanted to walk in kind of clean, and it shifted my entire world, obviously professionally. But I want to speak to, having had a lot of loss and death in my own life, and how that added to anxiety and anxiety attacks, and it really limited me in many ways. And my own brain spotting journey, my own work that I've been able to do, has allowed me to do exactly what we're doing here. If you would have asked me 5-10 years ago if I would have jumped on a podcast and talked out loud about my experience, I would have said, nope, I'd rather I'd have a panic attack and I wouldn't be able to do this. So part of that is, I want to say I'm more engaged in my life because of the work that I do, even as a person, not as a therapist. So I hope that encourages those that are listening out there to jump in and do their work. But as we talked about more last time around athletes, I love an example of two young college guys, both baseball players. Won't say their positions just because of what I'm saying, but one worked with him. Felt like he had the yips. Didn't know what they were. Finally discovered, reached out. We did our work, went from thinking he was going to drop out of baseball, didn't like it anymore, didn't have a connection to it because he was scared. It made him feel bad. And now he's on a top 50 list, going from sitting the bench 1 year to thinking he was leaving, to now being one of the top 50 that might get recruited in upcoming times. So that's a beauty in the work that he did to allow himself to get there. And then I have another baseball player, same age, and he was really good and he kicked butt. But through our work through Brainspotting and allowing himself to be with why he was a baseball player, he actually left baseball, stayed in college, and now is majoring in other things that he's more interested in, because he realized that one of his parents that had been abusive, that was his goal for himself. So he realized, this is not my goal, this is not my dream, I'm good at it, but just because I'm good at it doesn't mean that I should continue. So I thought that was a beautiful example of doing your work, but allowing yourself to follow what is most important to you, and especially these two young adults. I thought they both did beautiful jobs in very different ways.
Well, I really appreciate that. Thad Frye, licensed clinical social worker in Boulder, Colorado. Look him up, folks. He'll help you run faster, jump higher, sleep better, and become a more whole version of yourself. Thank you for your time, my friend.
Thank you very much.
That's all for this episode. Thanks everyone for listening. And if you're looking for more, be sure to follow us on social at WildHealthMD and head over to wildhealth.com or wildhealth.com/premium to become a patient and experience precision medicine for yourself.